Parkinson's disease affects 10 million people globally, and every year 60,000 Americans receive the diagnosis of Parkinson's disease. I'm here with Dr. Hubert Fernandez, who's going to tell us about Parkinson's, which has been in the news lately as singer Neil Diamond has the recent diagnosis of Parkinson's disease. People are absolutely terrified by this diagnosis, but there's new hope for them, right? This is not a death sentence.
Yes, it is not. It is no longer a death sentence.
What are the newest treatments, and what can they do for people? Can they restore them to their normal lives?
So Parkinson's disease is a neurological illness that affects really a small area in the brain that's responsible for coordination of movements. And right now, all Parkinson patients can receive what we call symptomatic treatments. They don't alter disease progression, they don't get rid of the disease, but we make their symptoms better. So they shake less, they're looser instead of stiffer, they're quicker instead of slower. So even if the disease is with them, they can live a meaningful life.
Would I be able to tell the treated Parkinson's patient from somebody who doesn't have the disease? Can you look more or less normal?
You can. Just like any illness, just like diabetes, heart disease, you have people affected with Parkinson's disease that are really mildly affected by it, and you don't even know that they have Parkinson's, and you have someone really severely affected by Parkinson's disease, and they have one complication after another, and a lot of people somewhere in the middle between these two ends. So they can look like normal, and they can be very recognizable as well. What excites me today is that we are now beyond the symptomatic treatments of Parkinson's disease, and we're beginning to look at interventions that can delay disease progression or can change it altogether and hopefully cure it. So,
what's our most promising new therapy?
Yeah. Well, the most promising new therapies, in my opinion, are the ones that really what we call cell-based therapy or targeted therapy, because as we understand the pathogenesis and the pathology of Parkinson's, we are now able to test drugs that can break that vicious cycle or that attacks the root of the problem, as opposed to really just improving the symptoms of Parkinson's.
So new hope for Parkinson's patients, symptomatically excellent treatment, and perhaps in the not too distant future, some cures.
That is our biggest hope.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.